Hello and welcome. My name is Dr. J. Michael Bennett. I'm an orthopedic sports medicine physician practicing in the Sugar Land, Houston areas. I specialize in minimally invasive and arthroscopic surgery of the shoulder, elbow, and knees, as well as sports medicine. Today we're going to talk about carpal tunnel syndrome, which is a very common problem. We see a lot of it. It's usually, there's a number of different reasons you can get carpal tunnel syndrome, and you see it in women that are pregnant. You see it in people that use their hands quite a bit for their jobs and their daily tasks. Sometimes you can have it secondary to a trauma or a fall. Sometimes we see it in patients that have other pathologies or other problems and health risks, such as thyroid problems or even diabetics. So there's a number of reasons you can get carpal tunnel. So today we're just going to talk about some of the symptoms and what is carpal tunnel. So just going through the anatomy, basically, if you look at your hand, all your fingers are basically controlled by tendons that allow you to flex your fingers. Those tendons run through the wrist in this region here, and they basically share this space with the nerve. The nerve is called the median nerve, and that nerve, and this is not exactly anatomically correct because you may have a few more tendons in this, but just to get the point across, these are a couple of bones, and then you've got a ligament that goes on top. It acts like the roof of that area. And so what happens is that you get a difference in your pressure, whether it be swelling from fluid, from trauma, for whatever reason, the pressure increases and it squeezes this little blue nerve here, and it causes causes some inflammation within the nerve, and sometimes that can lead to chronic scarring of the nerve and symptoms associated with carpal tunnel, which is actually numbness, tingling, and burning, primarily involving these three fingers, because that nerve comes through the mid portion of the wrist and it actually innervates these three fingers and then half of this finger, okay? And so you'll notice burning, tingling, primarily involving these three fingers. You may even notice some muscle atrophy or sinking of this muscle here in the palm area because the nerve branches off and it has a motor branch to this thumb region. This is called the thenar eminence. So you can actually, if you look at your hand and you start seeing a difference in your hands and you start seeing flattening of this muscle here, in addition to the numbness and tingling, that means you have carpal tunnel syndrome. And it may be a chronic situation if you start to see muscle issues going on, particularly weakness. So typical symptoms with carpal tunnel syndrome is consistent burning, tingling, that wakes you up at night, affects you during the day. You've dropping objects, patients have dropped objects, or they've hurt themselves or burned themselves, not even noticed it. That would be indicative of some sort of neuropathy. So if you have any of these symptoms, you do want to be evaluated by an orthopedic specialist or even a neurologist to actually get the appropriate test to determine what exactly is causing this neurologic change. Typically, the majority of patients that have carpal tunnel, it can be secondary to position and the way that your hands or wrists are positioned in most of the day. Some patients sleep with their wrists flexed at night. As I mentioned before in the cubital tunnel talk, you can have what we call the praying mantis position, where your elbows are flexed and your wrists are flexed and they're sleeping on that. And that actually compresses this nerve and irritates that nerve and makes your symptoms worse. So a lot of times you'll wake up in the middle of the night and shake your hand because it's getting you're getting numbness and tingling and it's really bothering you and you're not able to sleep. So if that's the case, that's usually, and it just occurs at night, that may just be positional carpal tunnel syndrome. And the first thing you want to do is see if you can change your position to see if that makes a difference. What I recommend is if you don't want to go to see a doctor at that point, go ahead and go to the store and pick up a wrist splint. It's called a night splint that you're going to use at night, and it just all it does is basically holds your wrist in a stable position so you don't flex it at night and pinch that nerve. It's a very simple wrist splint. This is what we give a lot of our patients here in our office, and you can find different types of splints out there, but all you do is slide your hand through the splint and tighten the splint itself. It wraps up like that, and all it does is keeps you from flexing that wrist at night. So when you're sleeping, you're not going to bend that wrist. So it actually keeps your carpal tunnel open and keeps you from adding to that pressure across the nerve. So now, if you decide to see an orthopedic surgeon or a neurologist, the first thing they're going to do is get what's called an EMG, which is an electromyogram, which actually looks at the nerves themselves and see exactly where the nerve is being compressed, whether it's going to be in the wrist, whether it's in the elbow, whether it's coming from the neck. They can actually determine that through this test. And depending on what that grade of compression is on the result will determine how you're going to respond to treatment. Majority of patients will have mild carpal tunnel syndrome. They're usually going to respond to a night splint, maybe an anti-inflammatory if they can tolerate it and if it's okay with their physician. The majority of people get better with that after a couple of weeks. However, there are some people that are more severe in regards to their symptoms and have noticed this atrophy and wasting in the hand. And if you're moderately severe to severe carpal tunnel syndrome and you have the EMG to show that, then the night splints haven't worked for you and the numbness and tingling is during the day and it's not just at night, then you may need to have a carpal tunnel release. And what a carpal tunnel release is, the old way we used to do a carpal tunnel release is just a mid-palmar incision right in the middle of the palm. So what you would do is just make an incision in the palm and you'd release this band of ligament here. Okay. Now there's a number of different techniques out there regarding the endoscopic approach for a carpal tunnel release, and we do an endoscopic approach here where we actually put a camera into the carpal tunnel and release the ligament from the inside out. So that way you're not having a big incision in the wrist. So we make a little incision at the base of that ligament and a little incision up top in the palm, and then we go underneath this ligament and we just use a little knife that actually splits that ligament and releases it. So it just releases it from the inside out. And that decompresses, it opens up that ligament, so it decompresses that area, the carpal tunnel, so now this nerve can breathe again. Basically the nerve is decompressed, the blood flow gets back to the nerve starts to heal. Okay, and the nerve can actually heal 1 millimeter a day depending on how long it's been compressed and how long of the compression, how long of an area of compression you have across the nerve. Now sometimes you can have it to the point where it's severe enough that even doing a release may not reverse the symptoms that you're having. That's why it's important not to ignore your symptoms if they're bad enough. If you're starting to notice muscle atrophy and weakness in the hand, I highly recommend that you have it evaluated by a physician just to make sure that you're not at that point where you're not going to see the benefits of having the release. So it's better, these are one of those things that is better to have it treated earlier than later, and you don't want to miss the opportunity to have it fixed. So that being said, that's really carpal tunnel in a nutshell. If you have any questions, please feel free to call our office at 281-633-8600 or visit my website at orthopedicsportsdoctor.com or jmichaelbennett.com. We go into carpal tunnel a little bit more in detail over there at the website as well.